welcome everyone. Welcome here to Gold. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And I am here today with Marie Zahorick, who will give us a wonderful presentation at the Midwifery conference titled, But You're Supposed to Be Happy, Perinatal Mood and Anxiety Disorder. So welcome, Marie.
Thank you. Thank you for having me.
Oh, it's wonderful to have you here for the Midwifery conference this time. And I love the topic. I do believe we have to talk about this, perinatal mood and anxiety disorders. I'll go there in a little bit. First of all, I would like to know from you about your background. You have a very interesting background. You're wearing many hats in your time in your career, right? So tell us a little bit about your journey.
So I'm from the Chicago area. I still live here in Chicago, Illinois, in the US. And I have 3 children, and that's how I got interested in women's health, because I had such a difficult time getting started breastfeeding with my oldest. And this was back in the late 90s. So I got a lot of help from La Leche League. And so I joined the La Leche League. I became a La Leche League leader in 1999, a lactation consultant in 2005, and then a hospital lactation consultant, and then I decided to go into nursing. So currently I am a psychiatric mental health certified nurse practitioner, specializing in perinatal mental health. I do general psychiatry as well, but my specialty is women's mental health. And I'm also certified in family practice, and I'm been a lactation consultant ever since. I'm not going to give that one up, since I do tend to use it quite a lot, even though I'm not directly helping mothers latch babies on anymore. And in the meantime, I just, found I initially got into psychiatry because we shared an office with the coordinator of the perinatal mood disorder program. She was one of the therapists, and she said, come work for us over on our side of the fence. I need somebody that knows about breastfeeding and pregnancy and medicines. And I said, okay. I hadn't thought of going into psychiatry at that point, but it seemed interesting and a big variety. And we have a really great organization where I work, lots of mentorship. And I did a fellowship that lasted several months and got trained in inpatient, outpatient, partial hospitalization, hospital consult service. And once I kind of settled in, I do still see inpatients in the hospital, but I mostly do women outpatient visits. And they tend to send me most of the pregnant patients trying to conceive, unfortunately, pregnancy loss patients, and then postpartum. And I also see a lot of women dealing with mental health / menopause symptoms, which of course, unfortunately, is a big overlap between the two. So we have to kind of, and that's true of a lot of women's mental health, I think. Everything is hormone driven.
Yeah.
Once you hit about age 10, it's go time until maybe age 60. And so I think it helps to be very aware of women's cycles and hormones, and not just to say, oh, it must be a hormonal thing, because that's pretty annoying, but to know,
Absolutely.
like, oh, you feel better around ovulation, but not around, the first few days of this or pregnancy. Some women feel better during pregnancy and then worse after, and vice versa. So at our office, I started there because the director of psychiatry wanted to get a better presence and a better service for women's mental health. And then fortunately, I knew a bunch of people who in nurse practitioner school, and they knew more people. So by now we have 4 nurse practitioners specializing in women's mental health. And all of us are former OB nurses. Two of us are labor and delivery. We're labor and delivery nurses, and the other two of us were more mother baby lactation consultants. But between all of us, we definitely, support the population as best as we can, and act as referral sources, from the OB departments and the midwifery departments locally. And thanks to telehealth, we are able to see patients more geographically.
Wonderful. Yes.
Psychiatry since COVID has been kind of a wild west, no holds
Hmm.
barred.
Yeah.
Um, I would say 90% of my patients do telehealth. Therapy is a little different. The therapists tell me more people want to come in to see them, but a lot of my patients, it's so nice to have that option because
Hmm.
one of my most recent patients, she's got a week-old baby. It's
Hmm.
10 degrees below zero. She
Yeah,
can sit in her living room. Her husband holds the baby, and I can see how she's doing.
definitely.
And that way they don't have to drag children out, find sitters,
Right.
take time off
Right.
work, drive 20 miles to see me. So
Yeah.
it's great for
It
women and their care.
And it's great for women, as you mentioned, because women often are the last to care for themselves because the
Mhm.
family, the children always come first, right? It's
Yeah,
always like that.
yeah,
And so if
exactly.
they feel like, oh, I can't go out, number one, in that weather, I don't have support to take care of my
Mhm,
other children.
mhm.
So, oh, well, my mental health will have to wait because I just, I can't do it or I don't have the means to do it. You
Yeah.
brought up something important earlier, and I love the setup that you have now. And what a huge change, right, Marie, from a
Mhm,
few years back when maternal mental health was first on the horizon, and now it gets talked more
mhm,
about, and your
mhm,
center growing in leaps and bounds. One sentence you said earlier about is all overlapping the hormones, the
mhm,
mental health and all that. What can we do as healthcare professionals to educate more on this? Because often, I mean, even I'm as a midwife,
mhm.
I encounter things where I go like, "Huh, I wish somebody had told me about this," or on my
Oh,
own body,
yeah.
let's say, right? Or with friends or families I serve. What can we do to kind of prepare even school-age children, our daughters and
Mhm,
family, friends,
mhm.
so we are not running into this dark field unprepared, so to speak?
So so I think being open about mental health is important, and younger people are much more open about it than people in their 20s and younger are much more open about things like that. They aren't
Hmm.
afraid to tell their friends. People can accuse younger people of quote oversharing, but it's a good thing
Hmm.
because my patients, my female patients, they have friends who have been through it, and they can refer each other to people. But basically, a lot of this is chemical, and it's not just because you're a girl and you're not tough, or you're getting older and that's just what happens to you when you get older, or that's just you being sad because your pregnancy hormones.
Hmm.
You need to have somebody that will listen to you. And I think it's important for younger girls to know that mental health is just important as getting pap smears, or
Hmm.
just as important as getting your teeth cleaned or your eye appointments. It's just a matter of taking care of yourself, because your brain is in the driver's seat, but sometimes it goes kind of off into
Hmm.
the fields, like you said, and you need to kind of drag it back. But and they also need to know that a lot of this stuff is chemical. Mental
Hmm.
health is very chemical. It's situational, like somebody has something hard or bad, or unfortunately, is a victim of something, and that's bad. and it can trigger something chemical, and none of that is anybody's fault.
Right.
You don't blame people for,
Mm-mm.
the emergency room doesn't blame people for, getting into a car accident when they were driving too fast. They don't stand there and look at them and say, well,
Yeah.
maybe we'll help you, but this really was your own fault. I
Hmm.
guess your leg's broken and we have to fix it. But they don't do
They
that.
don't do
And it's
that.
the
No.
same thing with mental health. Yeah, people don't necessarily make wise decisions and they can wind up with different mental health issues, but it doesn't matter. You have to, you know, be able to, as providers, offer help, kind of be able to eyeball something when it's not, when something doesn't make sense. In my presentation, there's a concept that probably midwives aren't so familiar with. It's called ACEs, and ACEs stands for Adverse Childhood Experiences, that they
Hmm.
use a lot in children's psychiatry. And
Okay.
ACEs are what you'd think they were, like different forms of abuse, neglect, divorce, death of parents, just unfortunately all the bad things that can happen to kids growing up. And the more you have, the more likely you are to have mental health issues, and the more likely women are to have, you know, perinatal mental health issues, difficulty adjusting to parenting if their family situation growing up was difficult. So learning a little bit more about childhood is not hard, but it can kind of give you an eye for, oh yes, I need to keep a closer eye on this patient.
Hmm.
Or once you get experience caring for patients, you get kind of a funny feeling that some of them, might
Hmm.
need a little more care in certain areas than others.
Right.
And basically being willing to, treat mental health, kind of like, not like it's an STI, but, things that we never talked about before,
Hmm.
and we wouldn't dream of not screening people for things, even if they're sensitive, so we have to kind
Correct.
of
Yeah.
throw mental health into the ring as well. And, nobody wants to have mental health issues, just the same as nobody wants to have an STI. But that doesn't mean we ignore that. You got to fix the things that are not working, so you can go
Right.
on and have a, nice healthy body, a nice healthy mind, and especially when you're in the perinatal period, so you can
Right.
have a good family, a happy baby, a nice life as a mother, and feel like you're
Hmm.
achieving your full potential and getting to be the happy family that you want to be.
Yes, absolutely. And I like that that you will be giving us in the presentation another tool for screening, because many midwives are very familiar maybe with the Edinburgh, screening tool. And so that will be something new for us to learn about
Mhm.
as well as thinking what comes next, because, many of us are screening and we want to do that and have that in our practice. But what comes next? Because still, midwives are not, psychologists
Mhm.
or
Mhm.
therapists or mental health counselors. We're not trained in that. So we need to have some kind of action plan in place for what comes
Right.
next.
Right. So, just like you have backup for when you have a complicated birth, you need to have a backup plan in place for when someone comes to you with mental health issues. It's nice if your organization has that built in already, but if not, you're going to have to go looking for a reliable local network, depending on your population, insurance, money needs, that kind of thing, of therapists, medical providers like nurse practitioners like me, physician's assistants, psychiatrists, psychologists to help with the therapy, counselors. You need to have a list of people that you can talk with, and you need to be careful and get consent from patients, because in many places mental health issues are very, very strict privacy policies.
Right.
So
Hmm.
you might need to do that a little differently, so you can in fact get permission to call up. And a lot of people say, okay, let's have you sign this paper and we'll sit here and I'll call this office while you're sitting here and make you an appointment for next day, next couple of days, next week. Because when women aren't feeling good, especially with mental health issues, they don't have the wherewithal to go down a pre-printed list of 15 or 20 people and try to find somebody who calls them back and
Yeah.
get into an appointment. So having kind of a, policy, a plan, a packet that you can go to and say, all right, well, we have our office assistant here and she will call the office over there and make arrangements for you, to have some kind of thing in place so that you're not sitting on your computer Googling, who around here does that, when you come into a situation. And then also my presentation talks about what to
Yes.
do in emergency situations.
Situations
And
as
those
well.
could be
Yes.
different. Those crisis situations, you
Yes.
also need to know what to do
What to
for,
do.
for emergencies.
Well, very good. Thank you so much, Marie Zahorick, for this sitting down here. I know we could talk forever.
Oh,
This is such an important topic. The time is just too short for this, but that's why we have your presentation, of course, coming up here at Gold. And to our viewers now, if you would like to find out more about what action plan to take when there is an emergency and more about, perinatal mood and anxiety disorders, please visit us at goldmidwifery.com, where you can sign up for the conference and be part of, the presentation where Marie is also present, of course, and the other presentations of the conference as well. Check those out as well. We have a live keynote presentation that you can sign up, which is open access, so you can enjoy the presentation, and it's available to everyone as well. Thank you again, Marie, for being here with me today, and thank you to all our viewers. Have a lovely rest of your day, everyone. Bye-bye.